Hey Pamela, Kristen's going to help me try to do our written report of findings today. So you'd asked me to do that before our conference call, which is tomorrow. So we're going to do a sample one and we'll see how it goes. So Kristen's going to be my sample patient. So Kristen, good to see you today. How you doing?
I'm doing good. How are you?
I'm doing really well, thank you. Have some good news for you. Okay, after examining your x-rays and the results of your tests, I feel confident what you have is treatable with chiropractic care. So the good news is you are in the right place at the right time. Okay, now because what you have is a chiropractic problem, I want you to understand some important facts about chiropractic. Okay, as you may remember from the video we had you watch the other day, chiropractic is not new. It's not experimental. It's been the successful choice of treatment for cases just like yours for over 100 years. Now the results with chiropractic have been so popular and so successful that it is the second largest healing profession in the Western world. And what's most important for you to know is that in a study reported by WebMD on millions of patients over several years, we have a 95% satisfaction rate with our patients. So you can be confident that you're in the right place for the solution to your problem. So let's talk about your condition. Why are you having this pain? Why are you feeling this way? Well, first of all, it isn't because of one thing. It isn't because of one turn or twist you made that was wrong. It's not because you tried to pick up something too heavy. This didn't just start the day the pain started. This has actually been building up for a long time as an accumulation of many events in your lifetime. In fact, it started with the trauma of childbirth, and it continued with the falls and hundreds of falls and accidents you had as a child and teenager. And now when you add that to the lifestyle you have now, that's why I said it's not just one event. You've had years of wear and tear. And keep in mind, this is with absolutely no prevention, no treatment, no care, no effort to offset this wear and tear. As an example, Kristen, that I like to give is, what if you never went to the dentist or brushed your teeth? Nothing from childbirth till now. What kind of shape would your teeth be in? You know, another example, imagine having a car where your tires were never properly aligned or balanced. A blowout would be inevitable. Through your years, you've had an innumerable amount of nerve damage and tissue damage and have virtually left it untreated. And you're really fortunate you're not in more pain than you're in. So what's the result of all this untreated activity and damage? The result is your spine has spent years being pushed and pulled out of its normal alignment. This is called a subluxation. Your nerves are being pinched and prohibited from performing their normal function of communication with the rest of the body. When those nerves are pinched, it has the same effect that a water hose has when it is pinched and stops the flow of water. That's how nerve flow is stopped, communication is cut off, and the result is disease. Now there are 4 stages of degeneration, as you can see here. And as with other conditions you may be more familiar with, like cancer, the longer you let this go, the more severe the damage and more severe the health problem. So it's important to start treating and preventing any further stages of degeneration. Right now it would place you in phase 2. Okay? So let me show you your x-rays so you know what I'm talking about. There's your x-rays, Kristen. Okay? So, I think we've spent enough time describing the cause of your problem. Does all this make sense to you?
Yes.
Okay. Well then let's move on to the important part. The part you really care about, the solution. I think I've already pointed out that your health problems were not caused by one event or one wrong move. This isn't something that just started yesterday, okay? The solution to your problem is a series of treatments we call adjustments. We're going to start adjusting your spine back into its normal alignment. And the truth is your spine has been misaligned for so long that it considers that to be normal. Now we're going to have to retrain the spine to what normal is. Time and consistency is what makes chiropractic so effective. And that's why it's very important that you follow the prescribed adjustments and treatments to a T. Can you understand why that's important?
Yes.
Okay. The number of treatments and the timing of those treatments are essential to your restoration. Okay? Now I've divided your treatment plan into 3 phases. And the first phase is obvious, pain relief. We want to get you out of this pain as quick as we can, okay? Now every person responds a little bit differently to care, but your first phase will include treatments 3 times a week for the first 2 weeks. We'll also be applying some therapies to supplement those adjustments. I'm confident at the end of this phase you're going to be feeling a lot better, maybe even out of pain, and you're going to be thinking problem solved. But Kristen, let me tell you, that's not the case. Your condition at this point is very fragile, and while it's true you may be out of pain or feeling a lot better, one wrong lift or turn, almost any event could set you back and we could have to start over. That's why the second phase is even more important than the first. This is called the stabilization phase. We need to stabilize your spine so you're not in this fragile condition any longer. Now, before we start the stabilization phase, we'll do a progress exam to make sure you're ready to graduate to this phase. This phase will be much easier. We'll start tapering your adjustments, usually 1 to 2 times a week for the next few weeks, and adding core exercises to make sure your spine's stabilized. At this point, we will do another brief progress exam to make sure that's the case. At that time, you'll be ready to advance to the third phase of your care, which is the preventive stage. So why is prevention essential to your health and wellness? Do you know? Any guesses? Well, you can say you don't know.
I don't know.
Okay, and that's good. Well, the one problem we have with treating your case is we have not eliminated the cause. You've not stopped the cause of what brought you in the first place. You're still doing the very things that cause subluxations. Picture like this: if you get your teeth cleaned, okay, it would be great if they just stayed that way. But that would mean you could never eat again, which we know isn't going to happen. You also aren't going to stop the activities that cause degeneration to your spine either. We wouldn't expect you to. But this time, instead of letting the wear and tear wear you down to the point where you can't move, we provide treatments to counteract this wear and tear. Okay? Prevention is always wiser than overhaul. Wellness care is better than sick care. Okay? We'll make a recommendation when we get to that point. Does all that make sense to you?
Yes.
Okay. Well, wellness is what you want, and wellness is what you need, and that is what we can provide. But before we get to that condition, there's a couple things I'm going to need from you. And the first thing is I'm going to need to keep all of your recommended treatment times. Okay? As we described earlier, time and consistency is what makes chiropractic so effective. Okay? Secondly, I need you to attend a special class called How to Stay Young the First 100 Years. This is a class I ask all my new patients and their significant others and family members to attend because I want them to understand about chiropractic and be educated about how it works. Okay, so before you leave today, Tara's going to make all of your recommended scheduled treatment times and your reservation to the How to Stay Young class. So, unless you have any further questions, I'm ready to get started if you are. Are you ready?
I'm ready.
Okay. Thanks, Pamela.